All right, so we're in the third part of this video series talking about what PCOS is. Today we're going to be talking about how do I know if I really do have PCOS? Can I trust the diagnosis that I've been giving? These are really good questions, and in this video I'm going to actually walk you through how PCOS is diagnosed, what to ask your doctor when you go to your visits, and how to make the most of your visits with your doctor, because the process can be very confusing. So remember, again, before we start, this is not personal medical advice. I am not your doctor. I'm here to help you, educate you, and help you learn. Please work with your own doctor or healthcare provider to get the right tests and diagnosis for you. But that said, you deserve to understand the process. So here we go. Let's break it down. All right. So symptoms. So what symptoms are you experiencing? Most women who have PCOS will have irregular periods. That's definitely the most common symptom of PCOS. Now, if you have regular periods, but occasionally you skip a period, I would consider that to be irregular, so that would count. Generally, if your cycles are longer than 35 days or more unpredictable, or they're not happening, that would be consistent with, irregular periods and maybe PCOS. Another one of symptoms would be signs of high testosterone or androgen, sometimes we call it. And that can look like acne on the face, acne on the chin. It can look like extra hair on the face, on the chin, on the belly. It can look like hair in other places. Now, that could just be genetic, or it could be related to PCOS. A blood test you could get can show high testosterone, but it could also show other symptoms, other signs related to androgens. And then again, on ultrasound, we would look for ovaries that have a lot of follicles. Follicles are not cysts in the traditional sense where they need to be removed or treated. So these are just ovaries that are full of follicles. All right. Now, your doctor is going to do some tests to rule out other conditions, thyroid problems, prolactin issues where your prolactin is high, which can be caused by a pituitary issue in the brain. That's a gland that lives in the brain. It could be a rare condition called non-classical adrenal hyperplasia, and there's a blood test to test for that one. You could have really high cortisol, not necessarily related to stress, although cortisol is a stress hormone, and that can be called Cushing's syndrome. Or you can have a tumor on the ovary, and this is extremely rare, but is a possibility. So that's why after we've excluded all of these things and we look at your symptoms, then we say, based on everything, we think you have PCOS. All right. So when you go to the doctor's office, they're probably going to test you for testosterone, probably your free and your total testosterone, your DHEAS, which is a hormone of the adrenal gland, your LH and your FSH, which are the hormones that your brain sends out in order to talk with your ovaries, your prolactin, and your TSH, which is related to your thyroid, and potentially other thyroid hormones as well. Related to your metabolism, we may check a couple other things, including your fasting insulin, your fasting glucose, your hemoglobin A1c, which can tell us if you're in the pre-diabetes or in the diabetes range, and your lipid profile, which will often include your triglycerides and your cholesterol, including your low density and your high density cholesterol. We also can check for something called 17-OHP, which looks for that adrenal issue. And maybe in certain cases we might check your cortisol depending on your symptoms. After that, we might order a pelvic ultrasound. Ultrasounds can help us look for issues with the ovaries. And if you have a lot of small follicles, which are like bubbles around the edge of the ovaries, that can be a sign that it's PCOS, although it's certainly not a requirement for the diagnosis. So ultrasound is helpful, but not always necessary. Now, if you are a teen, or if you are very young, in your early 20s, it's possible that if you're under 18, diagnosing PCOS is very difficult. That's because irregular cycles are very normal in the first couple of years. Teenagers will often have acne and hair changes normally. That's part of normal puberty and just growing up. And your ovaries can often have that sort of multiple cyst appearance on ultrasound that polycystic ovarian syndrome has, and that's normal for some teenagers. So oftentimes, if you're under 18, we choose to wait and watch rather than rush into a diagnosis for teenagers. But if you're struggling with symptoms, you deserve support no matter what your age. So I want you to be prepared for your doctor's visits, okay? I want you to bring in a log of your periods, and so that way we can tell exactly how many days your cycles are, how many days you bleed for, if you're skipping any months, so we can really understand what's going on with you. I want you to bring in a list of symptoms that you've noticed, including acne, hair changes, weight shifts, mood swings, etc. And if you have had any blood tests in the past, it would be very helpful if you bring that in as well. If you have a family history of PCOS, diabetes, or hormone issues, it would be good to talk with your family members to get clarity on that before you come to your visit as well. Don't be afraid to ask when you come to the visit, could this be PCOS? Are we able to check my hormones? Can we check my thyroid? Can we check my prolactin? Can we check these other labs? And then ask, what are my options if it is PCOS? So you really deserve clear answers, and I'm here to help you figure out how to get that. All right. So let's reflect together. Ask yourself, what do I hope to find out by getting tested? What would a clear diagnosis help me do? And whether the answer is finally feel heard, or get help with my acne, or understand why my cycles are so off, the reason matters. It's your motivation. So hold on to it. All right, so up next, now that we've covered how PCOS is diagnosed, you might be wondering, what can I do about it? So stay tuned for the next video where we talk about lifestyle and hormone balancing. Remember, PCOS is real. It's common. You didn't cause it, and you're not alone, and you can do something about it. Thanks for watching. I'll see you in the next video.